1 in 4 people actually have access to the information they need for health information and making good decisions. And so having these types of books, like the hand washing books, gives parents a resource to use with their kids and gives them that access to correct information.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
On this episode, we are talking with Erica Basora, clinical specialist at a hospital in Georgia. And I'm not going to bury the lead here, Melanie, but she's got a great story and a variety of experiences in her life. She's going to talk about them all today, and they all somehow wrap up into a conversation around communicating with children. It's an absolutely fantastic conversation that we're going to have today.
Yeah, it is. And I have to say that we have a previous podcast guest, Phyllis Quinlan. She's been on a couple of times. She is the reason that I got to meet Erica. She connected us after hearing Erica's story last year at the AORN Expo. And she's like, y'all need to hear her story. You need to hear what she's done and you need to interview her. And random email losses and whatnot that we finally got connected, and it just fit in so perfectly to this season and to this conversation. So I'm just excited to have her on the show, and I'm glad that she's here to tell her story.
Me too. Don't go anywhere. You're going to want to stay for the whole conversation. It's going to be a lot of fun. We're going to be right back after a short break with Erica Basora.
I'm Melanie Perry.
And I'm Justin Poulin.
A 17 Studios production, you're listening to First Case.
We are speaking with Erica Basora, clinical specialist working at a hospital in Georgia. And, well, Erica, you've got a great story to tell us today, and I can't wait to dive into it. And the theme is going to be communicating with children, and the whole season focused on communication. And we've also talked about communicating through different mediums or different styles or different languages. And I think a big part of the conversation is also going to be around messaging today and refining the message when you're communicating. So I want to welcome you to the show, and I want to thank you for being willing to share your story.
Well, no, thank you so much for having me. I am a fan. Thank you, Melanie, for inviting me as well. So very excited.
Excellent. Well, why don't you tell everybody a little bit about yourself and your experience?
Sure. Like Justin said, my name is Erica Basora. Currently, I'm a clinical specialist, but before this life, I used to be a teacher. So I taught 4th grade, 6th, 7th, and 8th grade. So as I talk to you guys on this podcast, you'll kind of see how nursing was married with my teaching and my ability to now publish and write books. But just a little bit about myself, I'm a second language learner. So my first language was Spanish when I was little. So I learned how to speak English, and it was a little bit of a journey for me. So even when I write some of my books now, I write books in Spanish as well, so I can reach that audience. And I have 2 little girls. I have a 14-year-old and an 11-year-old. So sometimes when I work in the operating room, I think of them, that when I'm treating different patients, especially pediatric patients, We can even go a little bit into more of one of my oldest. She has a story as well that's helped with the book that I've written. So I can kind of clue you guys in a little bit about that.
You set that up very nicely. But actually, it kind of very fascinatingly, I didn't know the part about you being a Spanish speaker, your primary language. And our second episode of the season was with Megan Codd talking about communicating with our Spanish speaking patients. And now you're bringing Spanish in as well to also help provide information and books and things that help make surgery less scary for our Spanish speaking patients too. And so I think it's a great tie-in that we've got both of those in the same season. But I'm already, my interest is already piqued. Tell me the story about your daughter.
So Jolene, who's currently 14, about 2 years ago, she was diagnosed with Crohn's. We didn't know everything from when she was little. We would always give each symptom a different excuse, whether it was, oh, she's allergic to this food, or she's tired because she's anemic and she's entering that stage where she's going through adolescence, she's sleeping a lot. And then finally she got really sick. And that nurse in me, the OR nurse, was like, oh goodness, I think this is what this is. Spoke to the GI doctor. I was like, I need you to stand by, and he's like, I'll be here if it is what we think it is. And she was diagnosed with Crohn's, and I had to be on the other side. I had to be the parent that was allowing their child to go into the operating room by themselves. And good thing that, she has had the experience of hearing my stories and knowing kind of what to expect. As a operating room nurse, I could kind of prepare her for that. But I know that there are lots of parents out there that don't have that same background or opportunity. So that kind of catapulted my decision to write my recent book, Little Miss Goes to Surgery, to give parents the opportunity to understand and know what's to be expected for their child as they go across the red line. The red line is a place where many people don't know what happens, but there's so many great things, so many great people that really help to guide and help the surgeons and just help individuals with their diagnosis. And we don't really get to talk about it. They don't get to see us. They're asleep. And specifically pediatric patients, they need to know that they're safe, that they matter. And then also for the parents to know that there's someone back there who's going to help them.
So let's actually break that down a little bit. Pediatric patients, your infant pediatric patient is not the same as your 16 or 17-year-old pediatric patient or your 10-year-old or your 13-year-old. I mean, the ages and stages of children are varied and vast, and we have to meet those children where they are when we take care of them. And they all have a different level of understanding, but they generally share a same fear and anxiety and a separation anxiety. So can you talk a little bit about that level of understanding that we encounter when we're talking with children about surgery?
Sure. So if you go back to nursing school, we have all the theories, right? We have Erickson and Freud. And so we have to remember those things as circulating nurses, right? And so we need to apply that. So in infants, birth to 1, they are establishing trust. They need their parents. So if we are doing a painful treatment, we want to bring that baby right back to the parent, helping them to cling to that parent and feeling safe. If we're talking about a toddler from 1 to 3, they're building not just trust, but they're building independence, right? They like to say no. They want to be in control. They have this increased curiosity and exploratory behaviors. So we want to make sure for those patients that we're doing things quickly, that we're ensuring that they have a safe environment, that we name the objects that we're about to use in a way that they can understand. And we want to provide explanation on their level. And then for preschool 3 to 6-year-olds, they are initiating play. So we have those kids that we want to encourage involvement, sometimes with toys, showing them the medical equipment, and then offering explanation about like the procedure that's happening, not just going right to doing the actual procedure, but giving them a little bit of a background, but through play. And then for school age, 6 through 12, they're really into privacy. They want to know what is going to happen and that they are capable of understanding the procedures that they're about to have. So we want to make sure that we're providing skin covering for the privacy, that we are explaining these procedures to them and showing them the equipment that we're about to use, but on their level. And most of the equipment that we're talking about is in pre-op, before doing an IV, kind of explaining what that's going to feel like and answering any questions that they might have. So, and then you have the adolescents as well too.
So tell me then, like the books that you've written, how many books have you written first? 2?
More than that.
Oh, I am behind then. How many have you written?
I've written 8.
Oh, wow. Okay.
Yes.
How many as a nurse? How many as a nurse is my question.
As a nurse, yes. So specifically on health, it's 3. But then I also have like coloring books that go along with them, and then have translated them into Spanish as well. So, you can count those additional, but 3 specifically on health literacy. And then the others are more personal.
Interesting.
Did you write any when you were working as a teacher?
No.
Really?
No.
Interesting. So when you left teaching and went to nursing, did you like almost miss it a little bit and that became the inspiration for writing books, or how did that come about?
I think I've always wanted to write a book. Being a second language learner, you struggle a lot. So you never think that I never ever thought I would be an author. But really what catapulted this was COVID. Believe it or not. During COVID, you had time. During COVID, I really couldn't be around my girls because we were so scared of transmission. We really didn't know. So my girls were a lot of times with their dad. And so I had the time to focus on this. I found a class online that helped me to learn how to publish. And because of all the fear and all the misinformation that was out in our world, I thought, well, what is one way that we can help our families? And that's when I came up with Little Miss Wash Your Hands, because washing your hands is like the key thing to preventing infection, right? And at that time, Ava was in 2nd grade and Jolene was in 5th grade. And you had that whole homeschooling situation going on as well. And that really was what catapulted the final, you can do this, just go for it. And that started the process.
Related to hand washing, I just have to ask this question. Which group is harder to get to wash their hands? Nurses or the kids in, K through 12?
Oh, see, I'm a clinical specialist, so I shouldn't say. No.
It's just funny because we learn about it all through nursing school, right? Every class, it's like they hit that home because it is the basics. But when you're in a fast-paced environment, it's like it becomes such second nature that sometimes I think it does need to be, everybody needs to get recentered on it. Right.
And, I will say that my coworkers are really great about keeping each other accountable, right? When we walk into each other's rooms, did you do the hand hygiene? But kids, they just love, singing the song, being in the bubbles, or just the whole action of it. So you can get a kid to really get into doing that.
Okay. So that actually makes me think of 2 things. One, you see all the studies where they actually culture nurses after they wash their hands, and maybe we didn't do as good a job as we thought we did. But I know that's a conversation for another day. But when you talk about your book about hand washing, Little Miss Wash Your Hands, or Little Miss Goes to Surgery, I remember looking at that book when I saw you in Atlanta, I think last October, November. But those books, what age range is that book written for? What pediatric population were you shooting for when you wrote those books?
Well, hand washing really for pre-K to 5th grade, because that's when they're going to learn the good habits and the habits that we need for life. So that was really what I was gearing towards for hand washing. But as a school teacher, I know that health literacy and those standards are really difficult for teachers to hit because they don't have enough time. So they teach those standards through books, during language arts. And so if you have it in a book, they can read it. They can teach kids about titles, authors, characters, but then they're also getting that hygiene piece in there. And so I thought, hey, this would be a great way for preschool teachers to read this to their kids to teach them how to wash their hands, but also kids in second grade, third grade who can read to themselves can now read this book and also get the ideas and the proper process for washing your hands. And I actually, when I was writing this, I had one of my scrub techs go through the whole process of scrubbing their hands so that I can, write this the appropriate way.
Right.
And then at the end of the book, I kind of have a letter to parents on how they can use the book themselves to teach their kids how to wash their hands and continue the conversation at home. And so at AORN this year, I'm going to get to talk to everyone about health literacy. And it's like 12% of individuals in the United States are health literate.
Wow.
And that's crazy.
Wow.
And 1 in 4 people actually have access to the information they need for health information and, making good decisions. And so having these types of books, like the hand washing books, gives parents a resource to use with their kids and gives them that access to correct information.
That's really cool. Yeah, that's important. It gives them access to correct information. And that is so key, right? By the way, you are on my list of people's presentations to go sit in at AORN. So I will be there in the audience.
Pressure.
No pressure, but I'm excited. But going back to that correct information, right? And when we speak to our pediatric patients, when we speak to their parents, think about when we go to pre-op and we're going to be bringing these patients back into surgery. There's a way to speak to our patients where we validate their fear and concern, but we see them as our patient and don't just talk to their parents, but talk to them also, but also a way to talk to the parents of those patients to also reduce anxiety. Is there any advice you have on best ways to communicate with these kids before they go to surgery?
I think sometimes we just need to pause, take a minute to remember how we felt if we've ever gone through surgery as a parent or as an individual. I think sometimes we get into, meaning nurses, we get into the motions of we have to get back with our patient. We have to do all the things, right? So if we just can stop for a second and take an extra moment to speak to the individual and get to their level. Remember that already there is anxiety just for the unknown. They've never, ever had an experience like this, most likely. They don't know what to expect. They have no clue about the steps that are about to happen. So just going through the motions isn't going to be helpful. So I think what we need to think about is speaking to them about what we're doing next. We're about to weigh you. We're going to take you back. You're going to put on this gown. We're going to put this IV in you, but not necessarily say IV. Describe it on their level.
Right.
To where it's going to be like a pinch just really kind of describe the actions that you're about to take and involve them in the conversation and in the process. That would be really helpful. And for parents, it's just sometimes you feel helpless in situations like that. You know that this procedure is what's going to help your child, but you don't want them to feel pain. You don't want them to be scared. You know that they might fear just being separated from you for that moment. And so having a nurse and, doctors too in the process that are going to keep being reassuring and helping them to understand that maybe that their illness isn't their fault. They're kids that might feel like this is my fault. I'm putting my family through all this pain and heartache and that it's not their fault. And really what we're going to do next is going to help you feel better. Give us answers. So kind of think through how we can be compassionate during these moments of true trial for these families. And I think that if we do that and we think and we see it from that lens, it'll really touch families and put them at ease.
So I know we're going to talk about the parents and involving them in the communication kind of next. It's the logical thing. But I want to ask you a question about, especially with kids, giving too much information. Can you address that? Like, I feel sometimes people are trying to do what you just said, and they think more information for a kid may help with that, and we all do that, right? I know what's going to happen more than you do, so I'm going to try to tell you everything I know and kind of do this dump. Is that a good strategy? Is there a balance there that should be struck? What do you think?
I think there is a balance. Again, we have to go back to thinking about the stage the child is in and speaking their language. So there are times that I'm in a meeting and they're saying, IVs and FTGs and all these abbreviations. And I don't know, I have no clue what that means. So we want to make sure that whatever abbreviations we're using, we're kind of speaking in their language. So Foley catheter, what is that? What are you about to do to me? And too much information.
Here's where I got it from. A lot of times, you have some of these conversations with your kids that are very important discussions as they're kind of coming older. And one of the things that I've heard from multiple different sources is, just answer the question they're asking you instead of going off into like everything that's tied into the answer, and really think about they may not need all the detail. They may literally just need not necessarily a yes or no, but they need a simple answer because the question they're asking may seem very simple to them. And then you kind of let their follow-up questions dictate to you how much they really want to know on a topic.
I agree with that. And so the only other thing I would say is for our adolescents or older kids, they know way more than you think. Mm-hmm, they can research it. They will have YouTube up right away. They think TikTok has all the right answers and everybody on there is an expert. I will tell you, my 14-year-old will tell you things, but I also have sat there and I've listened to her have conversations. Like she had a conversation with my sister. She wants to be a midwife. And she was talking to my sister about the stages of the babies and where they're at and I truly did not know that she knew as much as she did in the conversation she was having with my sister. And because it was a different person, she was able to explain that and communicate that way better than I would have ever done myself. So I think we don't give our kids enough credit. Yep. Depending on the stage.
I think that's actually a good reminder. It really is, because you shouldn't assume they don't know something. And you meet them where they're at and answer their questions, give them the information they need, but don't assume they're dumb, I guess, to put it.
And you don't want, and you don't want them to have misinformation either.
Yeah, exactly.
For me, I always speak to my girls in factual facts and I don't sugarcoat it, and they know the proper words for body parts and things like that because they're going to hear it somewhere else. Mm-hmm. And I don't want them to be misinformed. I'd rather them hear it from me. But when it comes to health providers, we just need to make sure that we are clear, but concise, like you're saying, and that we do respect where they're at and their parents as well. And possibly we need to think about the cultural backgrounds. All of that has to be taken into consideration.
So I want to I have a couple things. One, I really want to talk about Little Miss Goes to Surgery. But before we get there, I want to talk more about the topic and the idea of anticipatory guidance. It's this phrase that we hear all the time in nursing school. We got it time and time again as we are caring for patients and doing other things. But let's start there. Can you just kind of, for someone who might not be familiar, but talk about what anticipatory guidance is and how we can really use that to help our pediatric patients before surgery?
So again, it's providing information to those individuals and teaching them at the level that they're at. So using a book like Little Miss Goes to Surgery or Little Miss Wash Your Hands, it really helps for kids to understand what's going to happen next to me. In Little Miss Goes to Surgery, there's the character has a nurse that's telling them about the procedure that's about to happen to them and uses a doll. And so they get to see what's going to happen to them with the doll. And I know that some facilities are able to do something like that with their kids prior to surgery. In the book, there's also a video that shows kids what is going to happen. And the video is of a young boy who just went through surgery and how he was scared, but he came out, feeling better, and it wasn't as scary as he thought it was going to be. So using those guides would help to alleviate fear. And so it could be music. Sometimes we can use music to help alleviate fear and anxiety, resources such as books and the dolls and toys. So really, again, we want to reach the child at the level that they're at or the stage that they're at. And with the time that we have in surgery, that we're quick and fast paced. Sometimes some of these things have to happen prior to. We have child life specialists at some facilities. In my personal experience, our facility did certain procedures with pediatric patients, not all. So we're not a children's hospital. Like a children's hospital has a lot of resources, right? They have the libraries and the game room and the child specialists and the resources, whereas these other rural hospitals might not have that. And so we want to still provide our patients with a similar experience. And so if a book can help us and having stuffed animals to give them a little bit of comfort, we can try to do different things to kind of still provide that environment.
Yeah, no, absolutely. We don't have to be a pediatric hospital to take care of our pediatric patients well. We just have to remember that they are going to have unique needs and different ways to communicate than maybe our adult patients, but we can still meet their need in various ways, using books or the dolls or stuffed animals or teddy bears or things that we can do that we might have at our facility. But it's really key, I think, to remember how we talk to them. And they're not just the next patient in the next bed. And we need to communicate with them on a level that they understand. And I was actually thinking while you were talking about child life specialists, and it's a huge shout out to them for the job that they do for the hospitals that can take advantage of that option. My gosh, they're amazing. But also, we don't all have access to a child life specialist, but once again, we can still make sure that our pediatric patients are uniquely cared for in the way we communicate with them.
Right. And from my experience, my preceptor who kind of helped me through those types of cases, it was a lot of ENT cases and dental cases. She was absolutely great with these kids. And kids that were crying, she was able to ease them. She did like a little parade, and everybody they got to wave their hands. They were the king or the princess on the way to the OR.
Oh, that's cool.
She really did a great job in making them feel special, and that they were about to go to a place where they were going to be fine and comforted, and that princess or king.
Oh, yeah. I like that.
For the day.
Yeah, for sure.
I feel like with your background, you're almost like a child life clinical specialist. You're kind of both of those roles kind of wrapped up into one in a way. I realize you're not performing that function, but you have a lot of insight. And honestly, Erica, you're a very impressive individual. So I've really enjoyed listening to you educate us today. And, teachers don't get enough credit to begin with, right? But for you to have that combination, you're really in a great role. And you're also an entrepreneur. I mean, figuring out how to literally publish your own books, you've got a very broad skill set and quite a talent. So I just want to say thank you so much for coming on the show.
And
thank you for having me.
Also, just because we've been talking about these books left and right, where can somebody find these books?
Oh, great
If they're
point.
looking for them, how can you get them?
How can we close?
Yes. So they are available on Amazon as well as on my publishing site. That's lovepublishing.com. I have those resources as well on there. And they can always reach out to me too. I don't know if I can share my email, but you can always reach out to me. My email is erica@thatslovepublishing.com.
Okay. And you're also busy on LinkedIn. I've seen you around on LinkedIn, so they can find you there as well.
But the time that I have.
I understand. I do understand. We're busy, but I do get it. But I've seen you there quite a bit.
Yes.
Okay.
Yeah. But thank you so much.
Yeah.
Yes.
That was Erica Basora, clinical specialist working at a hospital in Georgia. And Melanie, this was a really fun one. And I really enjoyed just kind of hearing her entrepreneurial ways and, you know, having published these books. But also, I really am always impressed when people take very different experiences in their life and find a way to merge them into one complete experiential package. And the fact that she has put out all of these books, and as she talked about, you know, that English is her second language. And I think she learned an incredible amount about how to communicate by going through that at a young age. And it really, really shines through how thoughtful and intentional she is with her communication, which is a major takeaway, I think, for this season. And especially when you talk about the fast-paced environment. What did she say? Let's stop, think about where the patient is coming from, what stage of development they're in, and then, you know, approach the situation that way. That's a hard thing to do in a busy schedule, as she mentioned.
Oh yeah, it's so hard. And we get into that we fall into that rut of turnover times. We've got to hurry up. We've got to get this next patient back. We've got to get the case started. And we don't pause. We don't see our patients as people. Sometimes we just see them as the next case instead of the people that they are in that bed. And so thinking about that and meeting the need of the patient, speaking to them in a way they understand, are all ways that we can just really ensure that our patients feel safe, our patients have reduced stress, reduced anxiety, and that we just provide them the care that they need and they deserve.
All right, everybody. Well, definitely go check out her website, find her on LinkedIn, connect. And if you're interested in the books, they're available on Amazon. So definitely go there as well. That's going to wrap up this show, but another good one in the books. Haha, that pun intended. I do want to let everybody know that if you enjoyed this episode, or maybe you're having a hard time finding Erica's websites, you can send us an email, info@firstcasemedia.com. We'd love to hear from you, but even more so, we'd love to hear from you on social media, on the LinkedIn post. If you loved this episode, give Erica a shout out by sharing the episode on LinkedIn to your network and calling attention to the work that she's put in and what you liked about what she had to say today. So want to thank everybody for listening and let you know that you can also download our smartphone app for iPhone and Android, or find us on all your favorite podcast applications. And on behalf of Melanie and myself, thanks for listening to this episode of First Case.